Trojans Talk Research is a monthly spotlight on the research interests of choice faculty presented by Troy University's Office of Sponsored Programs. This month, Dr. Shellye Vardaman will discuss collaborative research initiatives.
Good morning, everybody. I'm Leanne, Director of Sponsored Programs, and I wanted to welcome our speaker today, Dr. Shellye Vardaman. Dr. Shellye Vardaman is a professor here in the College of Health and Human Services, still technically, and she has been with us for 23 years, and we look forward to hearing her talk this morning. Thank you.
Thanks. Good morning. I want to welcome everyone. We're going to talk about some collaborative research initiatives. I want to thank Leanne and the team at OSP for asking me to speak today, and it's a great day to be a Trojan. I want to engage the audience a little bit in today's presentation, so if you would take a minute and sign in to the presentation. You can join by scanning the QR code here. Take a minute to think about what collaboration means to you. So in 3 words or less, define collaboration. You can just type that in on your phone, and you can enter multiple times. So if it has more than one connotation, please type that in. Okay. Working with others, working together. Teamwork. Definitely. So that's kind of the essence. You definitely need to form a team when you're looking at collaborative research. One of the first initiatives I want to talk about is interprofessional simulation. We really look at this as IPE, or interprofessional education. So that's where we have more than one discipline working together to educate our students. In our college, that's very important because you really don't want to be educated in silos. Nurses need to know what physical therapy is doing. Physical therapists need to know what respiratory therapists are doing. We all need to know how EMS is working. So in this interprofessional education simulation, we actually collaborated nursing, athletic training, and our theater and dance students. So it was a very interesting collaboration. Our theater and dance students acted as our simulated patients. We developed scripts for them, and they acted the roles of the patients. We also had support from our community. We used high school HOSA students, and their sponsors came over on school buses to the School of Nursing. We used the intramural fields, and in the fall we had to use the Wright Hall gym because of the rain. We used local EMS. They came over with the ambulances and fire trucks, actually brought patients into our makeshift ER at the School of Nursing on stretchers through the ambulance. Students got to report off and ride in the ambulances with the EMS, how they would report off in a real crisis situation. We also had physicians that came to us from the VA in Montgomery to interact with our students. Students learned how to collaborate and talk to the physician. Many times that's kind of threatening to students. They don't know how they would talk to a physician. So here's a few images of what we have done. You can see we started off in the top, I guess your left corner, with debriefing. And this is Dr. Alan Jones in one of our classrooms, debriefing the students. We start out by telling them what we're going to do. And because this was research, we had a survey to begin this. So in this debriefing was when they took their initial survey. Our simulation involved a 5K where we had students that were running, and we had a bleacher collapse. So we had some with C-spine injuries, some that had heat illnesses, broken arms, sprained ankles, and we had moulage, or wounds, put on all these patients that were our theater and dance students. We even had some children involved so that our students were able to interact with patients of different ages. And you can see here are some of our theater students. They were brought into the ER. Students got to collaborate with the EMS, giving report over the phone to other students, bringing them in, and then unloading them from the ER, or from the EMS. And here on the bottom, you can see the physician actually working with the students. We've done this twice now, and we've been able to take this research, analyze it, and break down the data. We started this by gathering a team of interested researchers. So that's the first thing you need to do when you're looking at turning an experience into research. Who all wants to do this? It's never going to be successful until you have people who really want to do it. So we have a whole team at the School of Nursing. We have undergraduate faculty. I think I'm the only graduate faculty that's doing it. And we have athletic training faculty. The second simulation, we actually had students from Huntington and their faculty join us. We gathered evidence to make sure that this is something that's not new. Could we do this in our school? It had never been done with nursing, athletic training, theater, and dance. So this is something a little bit different. We found some measurement tools, found 2 validated tools. I touched base with the researchers at Texas A&M to make sure that we could use one of their tools. And since I teach at the graduate level, I'm very familiar with Qualtrics and how to utilize the tools. So that's kind of how I got into this research team. They needed somebody who was very familiar with developing surveys and IRB applications and things like that. So that's my role in the team. Then we developed the IRB proposal and sought approval. We do all of this through Teams. So we have a big Teams research folder. All of our documents are kept there. We can work in and out. Anytime somebody adds something to it, it sends the whole team a message. You know, go in and look at this. It takes a lot of planning. You need to plan, plan, plan some more. Like I said, in the fall, it rained. So that wiped out our plans of using the intramural fields. We had to go to Plan B, which was Wright Hall Gym. Spring, we didn't have a Plan B. Wright Hall Gym was not available to us. So if it had rained, we were just going to have to cancel that whole event. Fortunately, the weather held out, and it was a success. We were able to implement. The fall results have been analyzed. We have not analyzed our spring results yet. Next goal is to disseminate all of that research. You know, what good is research if you don't disseminate it and tell everybody what you've done? So the good news is, Troy Koppes helped us find a conference. We wanted to do something a little interdisciplinary. So this has been accepted for presentation and publication at the International Conference on Social and Education Sciences, in Chicago in October. Nikki Hilburn, her first name is Alicia, but she goes by Nikki. She is the lead of our team, and we're kind of taking different spots in the research team for different presentations. Whoever's leading it will move up in the chain. But as you see, this is an interdisciplinary research team. We have Nikki Hilburn, Troy Koppes, Rebecca Allen-Jones, myself, Katie Delinsky, Nikki Chin, and Joy Butler. Not everybody is tenure track. A good number of these are novice researchers. So part of the goal in this is to mentor these novice researchers. I think out of this, I've taught 3 of these undergrad. So I want to help these ladies research. And it's wonderful to see them get engaged. Another collaborative effort I'm involved in is the National Consortium of Academic Nurse Educators. I'm rather passionate about this. This started this time last year. And this all came from a National League of Nursing online forum post. Just a simple post. We had nurse educators from all over the country respond to this post. Everybody was interested in the academic nurse educator shortage. So with, I think, over 100 responses to that one forum post, we formed a group. We were hoping that the National League for Nursing would take us on, but they decided that was not really something they wanted to do, so we decided to start our own group. We spent the summer researching about the academic nurse educator shortage and how it contributes to the shortage of nurses overall. It's interesting to note that in 2021, nearly 92,000 qualified nursing students were turned away from schools of nursing because there weren't enough nursing faculty. Didn't have nursing faculty nor clinical sites in which to place them, so you can't take them into schools if there's nowhere to put them. So this group of educators from all over the country form this group. We have since incorporated it as a 501c3. We're having our first continuing education program in May. And I believe our membership is currently up to around 70 members. Like I said, it's advocating with like-minded individuals. We're trying to advocate for our role as academic nurse educators. Many times, nurse educators are not seen as a specialty role in nursing, whereas you see nurse practitioners as specialty roles. You know, academic nurse educators have master's degrees. They have to have specializations, role-specific competencies, but they kind of take a back seat to other nursing roles. But without us, you won't have baby nurses to go out in the field. This group allows the opportunities for people to engage in research, prepare manuscripts, have publications, do poster and podium presentations. Also, you're going to get mentorship from experienced researchers. There's a lot of us who have been in academia for many years. I think our group ranges from 5 years to 35 years. We even have some retired nurse educators in the group. So with that wide range, you're going to have a lot of experience, a lot of networking as well. Just based on this one group, you can see all of the publications and presentations that have been done. This is since really, I don't know, the end of last summer, this past summer. The first publication I'm very proud of is Addressing the Shortage of Academic Nurse Educators, Suggestion for Educational Institutions that's in Nursing Education Perspectives. It came out, it was published ahead of print. So it's not actually in the journal yet. You have to go online to read it. It should come out hopefully May, June. I've been asked to do a podcast based on this publication, because with it being out just a couple of weeks, it has generated so much interest in the journal that they want to do an hour-long podcast. So we've been in contact with radio, and they're going to put together a podcast, or help me put together a podcast with the journal. Another interesting thing about NCANE is with people all over the country, we help each other put together all of our presentations. Budgets won't support everybody traveling to every conference under the sun. But one person can't always put together a presentation. One person can't do the research, so it takes a team. So when you're in a collaborative team, the way we do it is whoever's closest to where the presentation is goes and presents our research. So Dr. Doria just happens to be based out of Salt Lake City at the University of Utah. She presented our research, took a different spin on it, but presented it at the Western Institute of Nursing. Dr. Shira is based out of Boston. She presented it at the Eastern Nursing Research Society. So we're all involved in it. We're all helping create the presentations, but one person goes and presents it. And that helps all of our budgets. And then the last one is currently in review, and it is addressing the nurse educator shortage recommendations for policymakers. You'll notice that all these titles are fairly similar, and this is because when we started this group looking at the academic nurse educator shortage, we did an interesting kind of research. It's called nominal group technique. Many people are not familiar with that kind of research. It's sort of, I don't want to say round robin, but brainstorming. You come up with ideas. Next thing we did was a SWOT analysis. Everybody did their own SWOT analysis, and we put those together, did a literature review, and kind of broke it down, and then came up with consensus of ideas, developed recommendations for each of our 5 stakeholder groups. And that's why they're very similar. You see, we have educational institutions, policymakers, then there's a manuscript for public and business. There's a manuscript for healthcare organizations. And I can't think of what the 5th one is right now, but we have another one as well. Currently, I'm involved in a Delphi study. I don't know if you're familiar with Delphi studies, but it's the type of qualitative research that goes multiple rounds. So when you get a participant pool, you send out the information, and then you ask for consensus on the different topics. Well, we've already completed round 1, and for a Delphi study, we had, I think, 1,011 participants in the first round. That is pretty much unheard of in a qualitative study. So when we teased it out, taking out the multiple respondents and things like that, it came down to over 600 respondents. That was a lot of data to have to go through. We had 42 original statements in that first round. And all these items came from our original research. So we're still going back to that first topic that we started last year. So all of this research is coming from one idea. We have an 11-member team that works on this Delphi research. After our first round, 40% of our items met consensus, which is awesome. So that's 17 of the items. We have since sent this back out for a second round, and that's 25 items that were returned for them to vote on. And when we say vote on them, they have the option of keeping the statement, keeping it after modifying the statement, or deleting it. If they want to keep it after modifying or deleting, they have to tell us why, or give us another suggestion as to how it should read. 2 of the items that we returned actually have 2 revised statements. We looked at all the feedback from our individuals, and they said, well, we really can't decide how we want it worded. So we came up with just 2 alternative statements, and they can vote. After the first day of round 2 being submitted, we had 68 respondents. So people are very interested in our topic. But this one Delphi study, we can do at least 6 different manuscripts off of. So it's going to keep us busy in research for several years. So that's just a way that you can keep research going just based off of one idea. Just take it and just keep building off of it. You don't always have to find new ideas. And this is some research that we started a couple of years ago. This was an NIH grant proposal with Dr. Glover, Payman, Renales, and Wilson. Wanted to look at music modalities. This was jointly picked up by NIH and NINR. It was not funded. We did work closely with the program director and got some feedback from her. We asked for close to $300,000. That was the max that we could ask for, was $300,000. And we also collaborated with the School of Music, or yeah, I think they're School of Music. It was looking at Troy Regional, trying to bring in some music, I don't want to say music therapy, but music interventions, nurse-led music interventions to our rural cancer patients. Hopefully, I have found someone who's going to pick up my role since I will be leaving in the future, and maybe they can continue this on without me. Dr. Payman was interested in continuing to work on this team. Dr. Glover, Renales, and Wilson have found that there's not really time in their schedules to keep on with the team. But I'm hoping that we can keep this ball rolling, because I started my career in oncology, and that's something that is, dear to my heart. are cancer patients, and so I'd really like to see this continue to move forward. Are there any questions? Hearing no questions, I thank you all very much.
Trojans Talk Research is a monthly spotlight on the research interests of choice faculty presented by Troy University's Office of Sponsored Programs.